There has been much said about the bravery of frontline workers during the pandemic, working with highly contagious people, sometimes without the right PPE. They are now being rewarded with an astounding statistic. The UN agency said this week that 1 in 7 cases of coronavirus recorded by the World Health Organization is a healthcare worker. Globally, around 14% of COVID-19 cases reported to a WHO are among health workers, and in some countries it's as much as 35%, said WHO Director General Tedros Adhanom Ghebreyesus at a Geneva news conference. It doesn't seem proportionate with the population, however, as data collected by the WHO shows that less than 3% of the population in most countries and 2% in almost all low and middle income countries are healthcare workers. The new data, though, measures up to other estimates. The Centers for Disease Control and Prevention found in April that healthcare workers accounted for 11 to 16% of COVID-19 cases. One possible reason for this could be that healthcare workers are tested more often, as testing for this demographic is prioritized when testing is scarce. There likely is a bias in the data when you see healthcare workers that highly represented, said Amish Adalja, a Johns Hopkins University Center for Health Security senior scholar. It underscores the fact that we still have testing problems 6 months into the pandemic. Yet, there is also the belief that the high rate of COVID-19 among healthcare workers is just purely because of their job and having limited PPE. At some level, it's not surprising. If you work in an environment with a lot of COVID-19, then your rate of infection is going to be higher, said Senior Vice President and Dean of Clinical Affairs at Baylor College of Medicine in Houston, James McDevitt. Healthcare workers are at higher risk of contracting COVID-19, and that is not simply down to testing differences, said Clinical Associate Professor Angharad Davies at Swansea University, an advocate of widespread testing of British doctors. Both McDevitt and Davies cited a study that was published in The Lancet over the summer. It studied 100,000 FRONT0LINE healthcare workers in Britain and the United States. The risk of infection in this group compared to the general community was 3 times as great. And this was after differences in testing were taken into account. While all of that is bad news, a British study found that staff in intensive care units had a lower rate of infection than general medical staff and housekeeping staff. Davies noted that although at first sight this may seem odd, possible explanations could include that by the time patients are unfortunate enough to be admitted to an intensive care unit, they are past the period of maximum infectiousness and because PPE use on intensive care units is likely to be very stringent. But COVID-19 infections are just one risk factor for health workers during the coronavirus pandemic. Many are facing being overworked and are struggling financially as well. They're receiving death threats as well because of their policies and recommendations. Tedros noted on Thursday that the data wasn't clear whether the healthcare workers had been infected at their workplace or whether they had been infected at home. Regardless, he said the WHO would be launching a charter on health worker safety. No country, hospital, or clinic can keep its patients safe unless it keeps its health workers safe, he said.